Welcome to the podcast, Unlikely Outcasts with Nay and Ange.
Join us as we explore our individual experiences through our 20s.
Learn about God's purpose for our lives.
Break generational curses.
Pursue careers in medicine.
And defend our way of life. This week's podcast title is On the Heels of Black Maternal Health Week. And today we're going to have a special guest, and I'll be moderating this episode today. So this episode will be mostly Nay and our guests having a conversation around Black maternal health. All right, so our guest this week is Khiara Lee. She is a graduating Master's of Public Health candidate concentrating in maternal and child health from Brown University. Khiara is from Coldwater, Mississippi, and she received her bachelor's in science in biology with a minor in psychology from Tougaloo College in Jackson, Mississippi. Khiara thought she would go to medical school and become an OBGYN, but instead she is currently doing research surrounding maternal health outcomes that negatively affect minority communities, specifically in the African American communities in the South. To deepen her research knowledge, she will be attending the University of Maryland to get her Ph.D. in Maternal and Child Health in hopes of becoming a research professor at an HBCU. So let's welcome Khiara Lee to the podcast.
Hey guys.
Thanks for being here, Khiara.
Thank you, Nay. Thanks for having me.
Yeah, I'm so happy to engage in this conversation with you. For those of you who don't know, my background is in medical anthropology, and my research focused on Black maternal health. So it's something that I'm very passionate about as a future family physician. So we wanted to take the time to highlight Black Maternal Health Week by engaging in research studies. So for those of you who've never heard of it, Black Maternal Health Week became official this year, but it was started by an organization, and we're gonna link their Instagram, but it was started by Black Mamas Matter. You can find them on Instagram by the same name, Black Mamas Matter Alliance. So for those of you who don't know, I'll read the White House statement of what Black Maternal Health Week is. But basically, it's a whole week in April. So this year, the dates fell on April 11th through the 17th. And the U.S. Department of Health and Human Services made an official statement saying, and we'll also post that statement in our episode bio, but from the White House, Black Maternal Health Week is a reminder that so many families experience pain, neglect, and loss during what should be one of the most joyous times of their lives. It is an urgent call for action. Black women in America are 3 times more likely to die from pregnancy-related complications than white women. This is on the top of the fact that women in America are dying at a higher rate from pregnancy-related causes than in any other developed nation. So I am so happy that they made that an official holiday or recognition, a week of recognition. Just to introduce why this is so important, I figured that we would quote some stats on Black maternal health. So according to Black Mamas Matter Alliance, and they also state their references and sources on this Instagram post. But relating to maternal mortality, according to the CDC, approximately 700 women die each year in the United States as a result of pregnancy or delivery complications, and almost two-thirds of the pregnancy related deaths are preventable. In 2020, Black women were most disproportionately affected with a mortality rate of 55.3 deaths per 100,000 live births, compared to 19.1 deaths per 100,000 live births and 18.2 deaths per 100,000 live births of white and Hispanic women, respectively. Um, in 2020, the Black mortality rate for Black women was three times the rate for white women in the United States. Multiple factors contribute to these disparities, such as lower quality healthcare, structural racism, implicit bias from healthcare providers, and underlying chronic conditions. The U.S. has an infant mortality rate of 5.4 per thousand, live births in 2020, with a health disparity among Black babies at a rate of 10.6 deaths per thousand live births in 2019. Um, BMMA also states stats on breastfeeding, which Khiara will talk about a little bit through her research, but about 74% of Black infants are ever breastfed, compared to more than 85% of white and 83% Latinx moms. Among all infants in 2019, Black infants had a significantly lower rate of exclusive breastfeeding at age 3 months than did white infants at age 6 months. The rate of any breastfeeding were 44% among Black infants and 59.9% among white infants. So that's a little bit on the numbers, the stats of why Black Maternal Health Week is important and why we need to highlight that Black women and children are disproportionately affected by these rates. Um, so, Khiara, introduce your research to us. Why did you choose this area to do your studies in?
Thank you, Nay. Well, like Anne said, I thought I was going to be an OBGYN. In high school, I just thought I was like, okay, I'm gonna go to Tougaloo, my illustrious HBCU, and I am going to get into medical school because they have partnerships with several medical schools, and I was going to be a doctor. And I was going to be an OBGYN because I had started going to an all black OBGYN office in Germantown. And I just like, I loved it. And I was like, this is what I want to do. Then I realized that I did not want to study for the MCAT. So I had to take a different route into doing that. And just like the disparity you read out about how Black women are 2 to 3, now it's like 3 to 4 more times likely to die from childbirth. I was like, even if I still wanted to buckle down and study for the MCAT, I would not be affecting as many Black mothers by just being an OBGYN. So I knew that I could do research and I liked the research. And I was like, I need to go get my master's in public health and hopefully my PhD and see if the research that I can do can affect things like policy to hopefully alleviate some of those structural racism and structural things that feed into the disparities for Black maternal health. Thesis wise, breastfeeding, I think I just fell in that. I definitely would have rather to look at severe adverse birth outcomes, but I can only work with the data that's out there that's publicly available. So I fell into the breastfeeding topic these past 2 years, and I have grown to love it because, as we know, we're taught that breastfeeding is you should do breastfeeding, but as you read that not many Black people do breastfeeding, and I wanted to see why, and I wanted to see if we adjust for things, could that answer to the wide disparity. But unfortunately, like many other things, adjusting for a few covariates did not answer the disparity. So still
Hmm.
have work to do.
Yeah, yeah, there's so much work to do in this area. So my program was not a thesis program, but it was more of a practicum. Um, they categorize it at under like activism anthropology. So you're connecting with grassroots organizations
Mhm.
and lending a hand in whatever they're working on. So I started a project from scratch. I partnered with a Black led midwifery clinic here, and developed a project surrounding capturing Black mothers' stories through their perspective using their words. So it was a photo voice project where I basically partnered with five of their clients. I believe four of them were like 1 month postpartum, and one of them was 1 month postpartum and currently pregnant. Um, so she had the perspectives of both sides, and it's basically giving them traditionally it's giving them a camera and saying capture your lives without me having to follow you around and document my observations. So that's exactly what I did. I let them capture their own photos, and I prompted them of, hey, show us what morning routine look like in your household. Show us what self-care postpartum looks like for you. What is your support system look like? And it was just a beautiful experience because I thought that I would walk into this space as someone that identify as a Black woman, but don't identify as a mother yet.
Mhm.
Um, and I thought that I was going to be able to teach them something that they didn't know
Mhm.
just because I'm in a master's program. And that was not the case. Like, I walked away learning so much more, and learning that Black women don't need us to come into their spaces and let them know that they're oppressed. Like, they know that already.
Yes, that is one thing I have had to realize here. You to check your education at the door, you know.
Hmm.
Just those letters don't mean nothing to actual lived experiences. So,
Exactly. Alrighty, so now that we know a little bit about each of our research projects, Ange is going to ask us some questions.
What does it look like to advocate for maternal and infant health
As
as someone who isn't a mother? Or just as, normal citizens here in the States?
I guess I can start. May. I feel like the main thing that I've learned, like leadership, advocacy, community engagement wise, is to listen first. Um, do not go into communities thinking that we know it all just because we sat in a classroom and took some tests and wrote some papers. Listen to what communities actually need, and different communities need different things. So make sure that we are hip to everything that everybody needs, and then go forth and think about solutions and ways to best get those communities what they need. I feel like advocacy isn't always black and white. Different topics need different strategies. And so I'm big on working with community leaders, like having a community board or something like that, to see and think and what the best way forward would be to advocate for the people within that community on the topic that we want to advocate for.
Hmm. Yeah, I would agree with everything Kiara said. For me, like I kind of said earlier, walking into those spaces as someone um, that does not identify as a mother, or a human caregiver. Um, I had to check my education at the door. I really did. Because the one thing that I didn't want to do, especially coming from a field like anthropology, which has a horrible, horrible history, along with, white supremacy and colonization. The last thing I wanted to do was to engage with these women as my subjects. So I was very intentional about viewing them and calling them partners or collaborators, because I was just as much wanting to know what they wanted to learn and what they wanted to study as much as I did. Um, and a huge part of that, and a huge part of why I even pursued my master's in medical anthropology at all, was that before I am a family physician, I knew I needed to deconstruct everything I knew about the American healthcare system, including everything I knew about maternal health. Um, because when you come from a background of research is available to us and we're seeing numbers without context, without stories and lived experiences attached to them, it's easy to take those things as face value.
Mm-hmm.
So it's easy to say this person has this disease because they chose to live a certain lifestyle, or they were born with some type of genetic makeup that made them predisposed to some type of thing. So it's easy to look at the stats and say and place blame on the individuals before hearing their stories. So that was something that I had to unlearn before I get to medical school, that these people aren't just numbers on a chart. There are neighbors, there are sisters, there are mothers, and they have lived experiences. They have histories that are important to their prior health, present health, and future health. And it's important for us as advocates, as care providers, to listen to those stories and experiences. So I definitely agree that it is walking alongside people and not coming in on a high horse.
That's good. So good. So the first point is to make sure that you are listening to the people that you're trying to advocate for. Don't come in with um, false expectations of what you believe based off of whatever class or course you took, or whatever article you read. There is misinformation going around these days, but be sure that you are listening. And in a general sense, every human in life wants to be heard. So, yeah. Yeah. All right. So the next question is, from your research, what do you guys think or remember, what was some of the main concerns of these women that you guys talked to, or in the articles that you read about, particularly Black women, regarding their health, regarding maternal health, regarding their infants' health, and that's during and after pregnancy, so pre, during, and post pregnancy.
Well, I feel like a lot of the things that I see, especially that because I also took a racism, and health class this last semester, and that is a whole subject. But I feel like the biggest thing, first, there we are at an intersection, because not only are we black, but we are women as well, and it's just like the intersectionality of what both of those things mean at once. And so race period for medical reasons plays a big role, and with mistrust in the doctors, insurance things, lack of health literacy knowledge and things like that, plays a big role in just going to get care, what type of care you receive, outcomes after the care. And so, like in several of the articles I've read, dealing with breastfeeding, is that a lot of women don't know. So the lack of knowledge about, like, the pain and, like, latching techniques and like what an inverted nipple is and things like that. And so these are barriers that you can't necessarily control for when doing quantitative research, because everybody has a little 0 to 10, the smiley face and like the really angry face of sliding pain scale, but pain isn't transferable. Like the pain I feel, we can feel the exact same pain and interpret it differently.
Yeah.
So that's one thing I feel like I'm seeing. And then also I feel like my roommate, she her MPH, her master's of public health, is in the health services. So she's taken a lot of like insurance classes and things like that. And I feel like that is, especially for black women, low income women, that is also another barrier to getting good care, is the type of insurance we receive. It's the in 2010, the ACA was
Mm-hmm.
enacted, and Mississippi is like one of the few states that has not expanded public insurance, Medicaid. So pregnant women get kicked off of Medicaid like at 6 to 8 weeks. And what I realized is that a lot of mothers that were on Medicaid that get kicked off, they don't even go to their 6 week postpartum checkup because they no longer have insurance. And that can affect health in several ways, if you don't go to your postpartum care. And then also that also, because some doctors don't like to accept Medicaid or accept some types of insurance, so that just your insurance type could tell where you go to get care, whether that is high care, like like a level 1 trauma center or whatever, or like just your local run of the mill. And I come from a small town, so going to a OBGYN clinic in Senatobia versus Germantown, the range of care is so different. And that I actually just sat in on a dissertation defense, and going to low or high quality care offices is what is the word? It's like a it's a barrier or a help of what type of outcomes you can have, because of course higher quality people offices have better health outcomes usually. So
Hmm. Yeah, I'm gonna answer the question, but that reminded me of a book I read by Dr. Khiara Bridges, and she actually spells her name the exact same way that you do. And her book was called Reproducing Race and Ethnography of Pregnancy as a Site of Racialization. So she basically did like a ethnographic study of this hospital in New York. Of course, she didn't say the name of the hospital, but I think it's one of the most popular um, free hospitals.
mhm,
Um, and she basically studied how these pregnant women of color were treated at that hospital, not only by physicians or OBGYNs, but women that look like them, that were nurses or,
mhm,
CNAs. Um, and she revealed that basically the racism that they faced and the unacceptable care that they received at this hospital was bigger than individual bias.
mhm,
But it was a structural thing of
mhm,
how these black mothers were surveilled and intervened on. Like, I think one of the even prerequisites of the women receiving OBGYN care was they had to go to some type of therapy on preparing them to be single mothers. So basically trying to deter them away from using welfare.
Mm-hmm.
And a lot of these women are like, no, I'm married or I have a support system. Like, you don't know anything about me,
Mm-hmm.
but I still have to go through these hoops just to receive basic care. So that reminded me of that. My own research revealed one of the scholars that I look up to in my field wrote a book. Her name is Dr. Dana Ann Davis. She wrote a book called Reproductive Injustice, Racism, Pregnancy, and Premature Birth. And she basically discussed three reasons as to why she believes Black women um, are disproportionately impacted by these birth outcomes. And through those through my engagement with her book and also talking to the women and listening to the women that I did my project with, I think that their main concern as Black women were not being taken seriously when it comes to pain or when it comes to decisions that they made before they even gave birth concerning how they wanted to feed their kids, how they wanted, who they wanted to be in the delivery room. So the three reasons that Dr. Davis gives is diagnostic lapses, and what that means is providers ignoring certain risk factors because of preconceived ideas of what a high risk Black pregnancy looks like. So, example, what of that would be people generalizing, oh, Black people naturally, quote unquote,
Mm-hmm.
have higher blood pressure. So, of course, this pregnant Black woman is at risk for preeclampsia. So that is something that they go into the exam room thinking that the Black woman would have, just based off of general stats. Another reason would be obstetric hardiness or Black hardy babies, and it's kind of similar in that um, those terms point more to describing the stereotype that Black people are superhuman and therefore can endure pain. And
Mm-hmm.
that just dates back to
The father
slavery.
of gynecology, yes. The
Yeah.
patient of
Exactly.
gynecology, yes.
Mm-hmm.
Exactly. So thinking, and we have so many examples of it in pop culture with Serena Williams and all of these other people that speak up and say, hey, I'm listening to my body and this is what I need. And providers not reacting to that or thinking, oh, you can endure more pain or
Mm-hmm.
you don't need an epidural or whatever, or you need an epidural sooner than, the woman would have liked to have an epidural.
Right.
Um, and then the last reason she gives is menacing motherhood. So basically, all of the preconceived ideas of what Black women look like as mothers. So you get the you get the perspective of this woman is not going to care about her baby. She's not going to care if her baby breastfeeds or formula, so we might as well give the baby formula.
Mm-hmm.
Or the opposite, oh, this woman is going to get on my nerves while she's in the hospital, so let's get her out as soon as possible. So these are preconceived stereotypes that are harmful to Black women's experiences in these birthing spaces, that impact their health and their child's health. Um, so yeah.
Yeah, I think I wanted to say something else because you reminded me is that like especially with breastfeeding, just another barrier is also the types of jobs that we as Black women are have the opportunity or afforded. to have, especially, if somebody who is like, say, a professor, like my thesis advisor, she just was on like, she was on maternity leave for a while, for like before and after she had her baby, but not everybody is afforded that opportunity to be on maternity care or FMLA for a long time. And so that um is a barrier to breastfeeding as well, because a lot of these jobs don't have birthing rooms or even refrigerators to put your breast milk in once you pump at work, so it doesn't spoil by the time you get back home to your baby and things like that. But then they wonder why Black women breastfeed, one, initiate breastfeeding less than white women, and then also don't breastfeed as long if they do breastfeed, because we have so much more life to have, I guess, jobs and things. We aren't usually afforded to stay at home for 6 months and not have to go back to work like other people are.
Hmm. Yeah. And I think COVID highlighted that. Like,
Hmm.
who's an essential worker
Hmm.
and why are they all black?
Yeah.
Why are they all the people that can't stay home for 14 days to quarantine? You know, so that's a structural question that needs to be
Yes.
answered.
Yeah, so let's just hop into this next question. It talks about the traditional medical system as we know it here in the United States. So, in your view, what issues affect Black women and women of color disproportionately in pregnancy and birthing spaces when interacting with the traditional medical system? I know, Kiera, you kind of touched on it with the insurance.
Um, yes, the insurance things, but also like we said it, the structural racism and the implicit bias of the medical caregivers. I mean, Nate talked about, the Serena Williams incident, and it hurts my heart to think that somebody of such grand stature has to go through something like this before people see, like, oh, this really is a problem. Because had it not happened to her and a few other celebrities or prominent figures, then some women back home in Mississippi or Louisiana, Alabama, they would still be dying from not receiving adequate care. I feel like a big statistic to say is that, yes, that however many women die of maternal, I mean, from pregnancy and childbirth things, but I think it was like the CDC, WHO, one of those big letters, said that like over half of the deaths could be like did not have to be deaths. They could have been avoided if the medical professionals did what they were supposed to do, did how what they were supposed to be taught to do. And over half is a lot, especially when you're talking about deaths, mothers and infant deaths. Like over half is a lot, and so
Yeah.
I just feel like the implicit bias, with the strong Black woman thing, that coming from the grandfather gynecology not using any type of anesthesia on his slaves that he was doing these, inhumane experiments on because they can take it, and that is literally still trickling down, and we're in the 21st century in 2023, and we still have some doctors that feel that way. And even if it's not the doctor, it is the outdated medical practices. When you think about things like transplants and like the different equations that oh, this person deserves a transplant, this person doesn't, but the literally me and another white woman could be the exact same thing on paper, but she will receive the transplant and I wouldn't, only because of the color of my skin. Grey's Anatomy, they talk about that on Grey's Anatomy, but and it's just, I feel like it's a lot of things like that where literally the deciding factor is, are you a Black woman or not? And that's scary because that for us can literally mean life or death. So yeah.
Yeah, absolutely. When I think about this question, I think about first of all, defining traditional medical system, right? So when we think of this, we think of, in this context, OBGYNs. OBGYNs are default the go-to provider that women choose, because first of all, sometimes it's the only option,
Mm-hmm.
and it's the option that's hyped up as being the safest, right? So I think a barrier that Black women and women of color face is not having access to other providers, such as midwives and doulas.
Mm-hmm.
Traditionally, historically, midwives perform the task of aiding women in birthing experiences. The medicalization of pregnancy itself is a barrier
Mm-hmm.
to care. Pregnancy isn't a disease that needs to be treated in a hospital. It's a natural occurrence, that should be supported in a way that the person giving birth sees fitting. So I learned through my project that, for instance, not all midwives are legally allowed to practice in all 50
Mm-hmm.
states.
Mm-hmm.
Even if they have the same credentials as an OBGYN, they may not have, the 4 years of medical school, even though the first 2 years it's just book work.
Mm-hmm.
But they don't have the respect. They don't have the legal system backing their practice, even though historically they did everything.
Mm-hmm.
Yes.
Today it's viewed as this granola crunchy thing that hipster white women choose to do for home births. And the Black women that want to go that route are discouraged. Um, Even not even looking at midwifery care, but doulas. Insurance doesn't cover doulas. And for those that don't know what a doula is, it's a person that's a birth advocate. So they're not doing the medical side of aiding a person giving birth, but they're supporting the family. They meet with you before you give birth to know your desires for your birthing experience. They help you and your family plan for, okay, who's gonna help you take care of the baby. There's postpartum doulas that
Mm-hmm.
come in and feed your baby while you nap. It's important to have support systems, and when these support systems are either bullied by OBGYNs in hospital spaces, or if they're not accessible via health insurance, I view that as a barrier to care.
Yeah. The subject of midwifery and doulas, it is, especially within the Black community. I wish we used them more, because that used to be us. Historically, that was
Yeah.
us.
Yeah.
We were grand midwives.
Mm-hmm.
I feel like I tell my mom all the time, a lot of this stuff links back to racism. Because we were, I mean, even if you look at it in a negative context, Black slaves would wet nurse the master's babies. Like they would call on the Black slave grandmother to come deliver the master's wife babies. Like
Yeah.
that was us. That's where those skills were handed down generation by generation,
Yeah.
from the motherland all the way to slavery. And then the slavery ended, the 1900s hit, and I guess when the war started, the white women had to start going to work, and they were like, let's make this a licensure, because white women, we might can't go to school a lot, but we can go to school more than the Black women, and so we know how to read, we know how to take tests and things like that. So let's make it harder for the Black women who has been doing this for generations. Let's make it harder for them to do that. So all the grandmothers that was delivering babies and could deliver babies and had very low maternal mortality rates and infant mortality rates, let's make it hard. Like you said, let's make it a hospital thing so the hospital can make money. Who owns the white who owns the hospitals? White families in the church back then. But and it's crazy because I had a midwife come in and talk to us, and like in Mississippi, wrote a paper on this because Mississippi has over half of their counties are considered maternity care deserts. Mississippi only has like 20 something midwives or doulas, and like only less than 10 of them are allowed to practice at hospitals. Like you said, like it's like hospitals and legislators have to allow them to practice, even though they did, even though they're a certified midwives, they did their 2 to 4 years of schooling and things like that. They even still have to be allowed to come to hospitals and work. And that's, I just think it's crazy. Because like, how have we've come so far? But yeah, I digress.
It's okay. It's okay. I 100% agree with both of you guys on that. So the next question is, how do we alleviate this? How do we fix the system? Can we fix the system? How do we alleviate the concerns of Black women and women of color in regards of the space of OBGYN? Like you said, you're going into public health and you're doing your PhD, so you could be in the policy making, change policy. Is it more than just policy? Like, what can we do to alleviate all of this?
It's truly definitely more than just policy. Of course, policy through my leadership classes, I feel like, a trickle down effect and a bottom up effect is what I feel like will work best. Policy is definitely the trickle down from the top to bottom. I'm not a policy girly, but it's all about who you have in your circle. So I said I will always ensure that I have somebody who's a policy person, lobbyist, or whatever in my circle to make sure, like, hey, this is what I'm seeing, this is what we're seeing, this is what needs to happen, this is what we feel, would be the best for the mothers of all races, white, Black, Hispanic, in our country. But also, I feel like another thing that I have been seeing in articles is just also community stigma. Um, so Mississippi has the highest teen pregnancy rate in the country. Um, and like, but we also kind of have like some of the lowest breastfeeding and highest maternal mortality. It's just so much, intertwined. And it's just like the community stigma part is the part where we could get boots on the ground faster. Interventions or, mommy support groups and things like that. Like, we talk about breastfeeding, but some people don't breastfeed because unfortunately, we have mothers and aunts and grandmothers saying it's okay, you don't have to breastfeed for real. It's fine, just give the baby formula. But not knowing that, knowing kind of, but not knowing how beneficial breastfeeding is to both mom and baby. And like even things like negative body image and things like that affect the Black African American community as well when coming to pregnancy. People be like, if you don't snap back, from after having pregnancy, or, if you breastfeed, your breasts are going to be long and hanky and saggy, and just all these negative connotations that come into being pregnant and breastfeeding is something that we could definitely help alleviate ourselves, conversations like it's okay, showing people what real life looks like after pregnancy. A lot of, mainstream media likes to gloss it over and be like, yeah, she was back out running around, da da da, looking good 6 weeks later, when in a lot of people's like actual lived experience, that's not true. We learn it through TikTok, different things that can happen to you through pregnancy that they don't teach in school. Like, your teeth can fall out, your hair can fall out, your milk ducts can be in your armpits. Like, it's just so much stuff that we could need to sit down and hopefully use the spaces that are already there. Kind of like, coming from the deep South churches or things like that. Cause it's we as Black people kind of take going to therapy as like you think I'm crazy type thing. So using spaces that are already there to start conversations to make pregnancy more real life. Like it's okay that you're struggling, like you want to breastfeed, but you are struggling with breastfeeding. Let me show you these resources that is out there. Or it's okay if, even if you are having postpartum depression, like some of us probably have had it too. Let's talk about it. Let's get a community around it. Cause like you said,
Yeah.
it takes a village. It takes a
Mhm.
village. And
Mm-hmm.
not it doesn't take a village just for the baby. It takes a village for the mother as well.
Yeah.
Exactly. Exactly. That was literally my like opening statement to my project.
Mm-hmm.
It takes a village to raise a child, but also to raise a community
Mm-hmm.
of people. Um, from my perspective, I think education is very powerful, right?
Mm-hmm.
And it's a twofold answer. Education is powerful in teaching birthing people about their bodies. I don't know about y'all, but I didn't have a sit down of what pregnancy would look like.
Mm-hmm.
Some people talk about never receiving, the birds and the bees talk and stuff like that. But I also never received, this is what's going to happen to your body when you're pregnant. This is what's going to happen to your body when you give birth and after and so forth. So literally having no idea and putting all of your trust in one person, i.e. your OBGYN or midwife, to take the wheels, that's scary for me. Like I want to know what contractions are. I want to know, what's going to happen to my anatomy at each stage. And I'm sure a lot of women want to know those things but don't know where to seek it.
Mhm.
Um, so I think education is key. And also, if you know those things, then you know what to advocate for when you're going through the experience.
Mhm.
Um, whereas no person should have to pull out a textbook and explain what they're going through in order for someone to take them seriously. Um, but it helps
Mhm.
to say, for you to appear to be knowledgeable about your experience. Um, so that's one thing. Being educated about your health and your body, and your desires for your birthing experience. Like I know a lot of women that I talked to that went the midwifery route, they had birthing plans. They knew what they wanted to do with the placenta. They just had, beautiful desires for this experience that they wouldn't have known unless they knew about what they're about to embark on. Um, so I don't place that responsibility solely on individual people. I think that those of us that are, going through these master or going to medical school and all these other things and gaining this knowledge, I think it's important for us to share that knowledge, with the people in our communities so that they could, use that as a weapon against structural things that are set up to harm them. The other fold of that education piece is how we train our providers, right?
Mm-hmm.
Like everyone wants to throw on their admissions website that, hey, we're forcing medical students to take this 1 hour class on cultural sensitivity
Mm-hmm.
and cultural humility, and that be it. So you force people to take a 1 hour seminar on, hey, don't be racist, but every single thing that you teach them the rest of the program contradicts that.
Mhm.
So I think that medical programs, master programs, anything that impacts the lives of other people in our community needs some deconstruction. Because you can't say, oh, we're not racist, but continue to teach things that are, embedded in racism and white supremacy. Um, So I think that the education piece is very important for alleviating these concerns.
Mm-hmm.
Okay, so I have a follow up. So we all know about Serena's story. I think we, prior to some of our research, was watching YouTube videos, TED Talks, and I think a PBS documentary about how different women of status, whether that be lawyers, celebrities, they're advocating for themselves. And like you said, they know how they want to birth. They've gotten their birthing plan done, but what happens when you can no longer advocate for yourself, and when that advocation it doesn't work? You know, you're constantly telling the physician, "This is how I'm feeling. This is the plan. Let's stick to the plan. I know my body," but they don't hear you. Like, what do you do when you're not being heard?
Hmm.
You want to go first, Nate?
Yeah, that's tricky, right? Because, like I said, with my experience from this project, I don't have to tell someone they're oppressed, or I don't have to tell someone how an experience could have been better. They usually, have an answer for it, but no one listened. Um,
Mm-hmm.
I think that trickles down to being intentional on who we involve, if you can, because a lot of people, like Kiera was saying earlier, there are deserts of people that only have one option, and that option is hours away. But if you have the power, I think one of our next questions would be, what are some things that you can ask before selecting an
Yeah,
OB? I think that you have to really take the time to know who's going to be on your side for things. I think a lot of people don't know that you can interview OBGYNs, you can interview midwives, like you don't have to accept their care. And I think having an idea of what does it look like for someone to walk alongside you in that journey. So is that person going to be a person that um make you take I'm blanking on the name. It's the medicine that pushes people along. So
Oh, dang. I'm
start with a
blanking on the
P.
medicine too.
Yeah.
Is it? I'm not going to say it right. I
Yeah,
already know.
yeah. It's a specific medicine that,
Pitocin.
yes, yes.
There we go.
Um when people aren't birthing fast enough, some providers push that on women, and it's shown that they have adverse birth effects from that medication, or have just added emotional trauma from being rushed through that process. So that's a question that you would need to ask your provider of, are you going to let me take the time that my body needs to go through this experience, or are you going to rush me along so you can feel the bed? um so questions like that. Am I allowed? How many people am I allowed to have in the room? So that if you're not listening to me, you dang sure going to listen to my husband or my mama or whoever else in the room, and that's something that you need to know beforehand. But yeah, I think it comes back to the responsibility of listening not being something that the individual person should have to control. That should be, you should not be a physician if you're not going to listen to your patients. How do we prevent that on a structural level? I have no idea. Stop letting a-holes into medical school. Like,
period. Simple as that. That's the
so
simple
simple.
solution.
If it was only so
I
easy, huh?
know.
I on that tip of, like, pushing the pitocin, pushing the pregnancy. I feel like when OBGYN shifted to wanting to schedule C-sections versus natural deliveries. That is a big thing. I'm all about, I'm a quantitative girl. I know you did like qualitative work. I'm a numbers girl. Hopefully in the future I can do some more mixed methods things, but just like statistics wise, like Mississippi has one of the highest C-section rates. Like, you know, my aunt is a nurse practitioner, and she's like, yeah, those doctors would very much rather schedule your C-section so they can know how their day goes instead of waiting on the body. Because, you know, women can be in labor for Lord knows how long. You know, it ain't all 2 hours. Some people be like, you know, I was in labor for 32 hours. Da, 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 da. And so a doctor having to be on call, they feel like that inconveniences them. But I feel like you knew what you was getting into. You know, birth is unpredictable. Yeah. So hey, so that C-section thing is a big one for me. Like, you know, unless there is like dire consequences, like, you know, the baby's heartbeat is, you know, going down every time the mom is having a contraction, or the mom is like losing fluids or something, then okay, yes, emergency C-section is definitely required. But, you know, scheduling C-section, especially if I'm not high risk, is crazy. But so for one of I think my interventions class that because, you know, public health is about, you know, interventions and all of those things, seeing what could work. Definitely, I feel like having more birth advocates of color. I know you said doulas are like birth advocates, but like having advocates within hospitals, because hospitals don't like for doulas and like midwives to be inside their walls. So like having more advocates of color, um, better, like beneficially, is like those who have also been through birth themselves, hopefully not, you know, severe adverse, but at least knows exactly what birth feels like, you know, because, you know, we have a lot of male OBGYNs, they do not know what birth feels like. So they can't tell us like, oh, you'll be fine. If I could transfer this pain, I feel like some mothers would feel like that. Like, if I could hold your hand and transfer this pain, you tell me if I'll be fine, you know? So I definitely think, like, you know, advocates of color, who, and I hate to feel like this, but, you know, in America, education speaks, status speaks. And so, you know, so I feel like a lot of people, we've touched on the education piece, is like, if mothers aren't highly educated, which in fact, a lot of, you know, me going to get my PhD, I am still more likely to die from childbirth and pregnancy than a white woman who didn't graduate high school. And that is mind-boggling to me. Like, you telling me I have my PhD, I am well educated. It might not be in medicine, but I am well educated, well attuned, and you're still going to ignore me. You're still going to ignore, you know, my like cries out for help. So, you know, hopefully, you know, things like birth advocates that have some type of education, like maybe like some medicinal education, I feel like that could, maybe doctors would maybe respect them more than us. But that's a hard question to answer, because it's just so deep seated. It just has its claws so deep in. It's just
deep.
like we don't know which claw to extract first. So yeah.
Yep. So the next question was about how could we get Black women and women of color to educate themselves, but you guys kind of talked about that already. Is there anything else you would like to share about maternal and infant well-being? Even if that's accountability, we kind of talked about that, accountability with the physicians. If you make sure when you're trying to choose a specialty to go in, if you're in med school, if you're in PA school, if you're going to be a nurse practitioner, and anything with the medical field, nurses, even just regular CNAs, MAs, RNs, LPNs, if you be conscientious about the specialties that you're choosing to become a part of. If you cannot advocate for your patients, if you are not understanding of how they feel, you should not be a part of that specialty. There's other specialties that you can be a part of, where you're not doing more harm to the patient, They're not. I mean, one of the first things you learn in medical school is do no harm. Do no harm. If you are if you think you're helping them but you're harming them, like, there's no point in doing it. And some of these physicians, they do need to be held accountable. And like you said, Nay, that 1 hour class is not going to hold the future physicians accountable. That's just basically them reading an Instagram post and going on about their life. Is there anything else either one of you guys would like to share about maternal health or infant well-being regarding your studies or your research or anything that you want to do in the future? Yeah.
Future Khiara, yes, I would love to be a research professor at a HBCU. HBCUs are near and dear to my heart. And we're talking about Black people, so why not go teach and educate the next generation of Black people? But outside of that, I would definitely love, love, love. I probably won't be back in Mississippi, like, you know, for Lord knows how long. It's giving more retirement state than live in state right now. But
LOL.
I would love, 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 love to come back home, or at least have some ties home for like seminars or something like that, especially geared toward like helping alleviate those teen pregnancy rates. My mom was a teen mother. It's just, it's a lot. Like you said, we already, as older women, in within those birthing ages, like, we already don't know what pregnancy looked like, and so we don't even know what life looks like as teenagers. So helping with that, and then also just hopefully I would be able to have some seminars with some older women who are more seasoned with, just helping mothers in different communities, not just in where I come from, but all over the state of Mississippi and Memphis, by Tennessee and things like that, because I feel like we are in need. My aunt, she's a nurse practitioner over in West Memphis, and she talks about trying to start some businesses or a business, around Black maternal and children, just helping the well-being of our children, because they're the next the next generation.
Yeah.
So that's what I see. Hopefully, you know, you know, for me, like a selfish tip, I want to become like one of those people, like, she is world renowned within her field.
Amen. Amen.
She is
Amen.
producing groundbreaking research
Amen.
and influencing policy, pushing
Yes.
insurance expansion for pregnant women. That is really, what I hope to that my research does. Because maybe one day, I don't know, way far off in the future, I want to be a mother. I want to be pregnant, and I don't want to succumb to the things that we are talking about now.
Yeah.
So, yeah.
Absolutely. Yeah, thank you for sharing that, Kiara. Um, I think for me, one thing I learned and continue to learn every day is that mothering, and when I say mothering, I don't mean people that identify as women that give birth. Because we have a lot of mothers in our communities that did not give birth to us. But when I say mothering, I just mean caregiving in general is so powerful. Mothering is political, mothering is activism. Um, and it is just so powerful, and it should not be taken lightly. So I hope that as a future physician, that each person I encounter, I learn from, and I kind of add a little more to my toolbox. I I don't think that I can single handedly change structural racism or anything involving our American systems. But I can at least impact my brothers and sisters, my neighbors, my community,
Mm-hmm.
wherever that community may be within the country,
Mm-hmm.
through my work and through just bringing awareness. I hope that this podcast episode brings awareness
Yeah.
to the severity of uh, maternal health disparities, and that people, that have more power than us or less power than
Yeah.
us, take something away from it. So
Mhm.
I think we're already starting the work. We're already
Mm-hmm.
doing the work
Yeah.
just by
Mhm.
showing up to this.
Yeah.
Yes.
Yeah.
Yeah. I agree with you, Nate. Being a lifelong learner. That's what I
Yeah.
Hmm.
call myself. I mean, I'm gonna go back to school yet again. No
Yes.
break.
What is it? Is it 7 years? How long is this program?
My program is only gonna be. I'm gonna try to do my PhD in 4. You know, they
Okay.
say 4 to 5. I'm gonna try to do it in 4. God willing, I will be graduating in 4 years. You know, Dr. Lee. I'm not. I'm
Okay.
not trying to spend no much longer than I need to be in school. But yeah, and just like you said, like mothering. Um, I just want us to know how strong. I know we're strong Black women, but mothers are
Yeah.
strong. They have created communities and groups that have changed policies like lead policies, physical activity
Yeah.
policies, and I feel like I want us to know that if we can come together over something like this, the outcomes and the solutions could be monumental.
Hmm.
All we gotta do is band together. We don't have to all be doctors, MPHs, MBAs, whatever, medical anthropologists. We can just be mothers and be like, these are our struggles and this needs to change. So
Hmm.
yeah.
Yeah, I love it. I love it. I love it. Okay, and so here on the podcast, we have a segment where we call Soft Girl Living. And so our Soft Girl question of the week is, what is something about Black mothering that we are unlearning? So something that we saw our mothers who birthed us and didn't birth us, our grandmothers do that we're turning a new leaf in that if we become mothers, we want to do differently. And if we mother, not even just our own children, but others, because just like we said throughout this podcast, it takes a village. What are we unlearning about being, about Black mothering?
You can go, Nay.
Um, the big thing I think is that it's nuanced. There's not one type, there's not one way to mother. I think that there are things, similarities that we can relate to each other on when it comes to how we were raised, or, how we plan to raise our children if we choose to be mothers. Um, but I think it's important not to reinforce stereotypes of what Black mothering looks like, um, and reinforce those tropes by, not performing those stereotypes ourselves, but um, not judging other
Mm-hmm.
mothers. I think that Black women in particular are under a lot of surveillance. Every
Mhm,
little thing is
mhm,
makes an impression of what people think it is to be a Black woman or be a Black mother. So I'm making the conscious decision not to do that myself, not to react to things in public. React to how a woman is parenting her child in public or not parenting her child in public, because that just reinforces
mhm,
harmful stereotypes and tropes. So I think just being aware of not causing further harm to women that look like me, um, coming from the perspective of I don't know what it's like to take that child home. So who am
Mm-hmm.
I to pass judgment on how you react to what they're doing in the grocery store or at church or whatever? So
yeah.
that's one thing for me.
For me, I have enjoyed my public health, my MPH. So I just got finished taking a parenting style class. So
Oh,
I you realize how much you don't know goes into parenting. Um, but I
Yeah.
feel like a thing I'm unlearning is kind of similar to Nay's. It's just the style of parenting. You don't have to always take on your mother's or your grandmother's style of parenting, mostly because we live in a new time than when we were raised, even if that was, simple 25, 28 years ago. And it's okay to not know. I feel like a lot of people just feel like they should know everything, but just like anything, stuff is new. And
Mm-hmm.
also like not being afraid to reach out for help. I feel like as
Yeah.
Black women, we have to be so strong, and like we feel like we kind of have to know it all and weather it all, and we can't really reach out for help, because then that lets other people know that we don't know something, or we might be
Yeah.
falling short. And like you said, we're under so much scrutiny, and one wrong move,
Mm-hmm.
CPS can be
Mm-hmm.
called in on our doorstep for our children. But yeah, just thinking about parenting styles, the whole gentle parenting and everything, disciplining, those things are, seeing like, oh, if, my mom, it happened to me, but, checking like, looking internally, but Kiara, are you okay? Like from that. So yeah, those are the things that I feel like I am unlearning or will try to unlearn when I choose
Mm.
to become a mother.
Yeah. I
Awesome.
100% agree with both of you. Some things that I'm learning, like you said, here, I think is um also just to take it day by day, and to be okay with being wrong. No one gets it right the first time, not even the second time. But like you said, the biggest thing is to ask for help. I really don't ask for help generally in my life. So imagine me being a
Mhm.
mother.
Mhm.
I would probably be like, no, I got this. And I'll be in my room crying, But I would definitely learn to ask for help. But also, what am I? Make sure that the community around me understands my methodology of being a
Right.
mother, respects that methodology, regardless of how they were raised or whatever. I think it's like we were talking about earlier about being heard, being heard, and that goes on with everything else. So yeah, I have one last question for Miss Khiara, and that is, we are at the bottom of our podcast. We say that we are doing justly, loving mercy, and walking humbly. So, what are you doing this year, presently in your life, to do justly, love mercy, and walk humbly?
Hmm. Oh, I was not expecting that one. What I'm to say the three again?
Do justly, love
Mhm.
mercy, and walk humbly.
Um, I would say the main thing that I try to do to walk humbly is show up as my best self,
Mm-hmm.
but kind of like Nate always already said, it's like, but know that I don't have all the answers. I feel like I can get quick into baby, I'm smart. I can do this, but that when I walking into new doors and new places, knowing that I might be smart and I might be somewhat knowledgeable, but I still have very far to go, very much to learn. Always trying to be a sponge, but also trying to also be a help to others in any way that I can. Not a mother, but if a mom needs help, or even just like maybe looking up, googling resources, just trying to give to people, just trying to help,
Mm-hmm.
because any small things go a long way.
Yeah.
That mama might not be able to have the time to Google like breastfeeding resources. If me making a pamphlet for, different states to give to parents and give it to mothers, so that their lives can be a little easier. That is always what I'm trying to do. I feel like that's public health, making brochures, interventions, making other people's lives
Sounds
easier.
good.
So, yeah.
All right. Anything else today, or you good? All right. So that wraps up our episode for today. Much appreciation to you, Khiara, for joining us today.
Thank you for having me.
Yes. We must do it again. I'm sure there's other topics that we can talk about regarding your research and then your future research during your PhD program. So come again, please. All right, guys. Bye.
Bye.